Hi, and welcome to Wow Talk. I'm Donna Cappuccitti, a thriving cancer survivor.
And I'm her naturopathic doctor, Darlene Gustin. We're here to encourage, educate, and empower you on your journey to optimum wellness. Hi, welcome.
Hi. Today's topic is acne. Yeah, so that's a
Yay.
big one, right?
It's a big one. It's a big one, but it's a simple one to a naturopath. I've had the blessing of never really having experienced acne, maybe the odd pimple when I was a teenager, but I really sympathize with, you know, seeing people embarrassed and suffering, and it doesn't feel good when your face is erupting. No.
No, it doesn't. I've been through it, so I do understand. Oh my goodness.
Mhm.
I know you understand, but I've had to live it. So, and it's something that's was with me for years. Like it started when I was quite young because the hormones, I guess, were raging at an early age for me.
Yep.
But you can probably explain this a lot better than I can. And then it's been a matter of managing it. And through the 70s, it wasn't easy. I mean, today we've made such progress, but anyway,
Mhm.
why don't we start? Why don't we talk about what is it? What is acne?
Well, the way I explain it is that everybody has bacteria on their skin.
Hmm.
So whether you have beautiful, perfect skin or a whole bunch of craters and mountains and pustules erupting all over your skin, the same bacteria lives on their face and mine. But something on the inside changed that overfed those bacteria, let them over multiply. And they're actually little tiny bacterial infections. And that's why medical doctors sometimes prescribe antibiotics.
Oh,
But naturopaths think differently. Our philosophy is that it's from the inside.
yeah, that makes sense.
So, yes, there's topical things that you can do, different creams and teas and steams with tea tree oil, facial steaming. Yes, all those things work, but the primary treatment plan is from the inside out. And what changed about your bloodstream that made it favorable for these bacteria to overmultiply themselves? And one of the common things in puberty, anyway, because most of the people suffering with acne are teenagers, is an increase of a hormone called DHT, which is a powerful version of testosterone. And if we dig deeper, because naturopaths are focused on root cause, we keep asking why, like a 2-year-old. Why? Why do I have acne? Because the bacteria overmultiplied. Why did the bacteria overmultiply? Something changed in the bloodstream that they really like. Oh, what changed? The DHT went up. Why did the DHT go up? Probably because you don't eat enough zinc.
Oh my goodness. Oh my goodness. I love that dialogue you just had with yourself. That was incredible. And it all comes down to the zinc. Okay.
For many
Yes.
people, it
Whoa.
can also be related to other things. That's one of the big answers. The first thing with any skin condition, the first thing I'm looking for is, do you need zinc? And zinc is, even if you ate perfectly and organically, zinc has been depleted in the soil.
Okay.
And zinc is a mineral that's involved in over 2,000 bodily functions. So whether it's
Wow.
an increase of DHT or a drop in immunity or growth and development. You're 14-year-old boy who's too short compared to your classmates. Like zinc. So that's the first thing I go looking for, especially like the case history makes it so obvious. Like when a person says, I don't know why I have acne. When did it start? When I was 14. Is that the year your period started? Well, what do you think's causing your acne?
Yeah.
You know?
Yeah.
So hormone, right? But also teenagers are not really known for the best diet.
Okay.
And, maybe they think they're healthy because they're eating Greek yogurt, or maybe they're really eating pizza a lot of the time. The common denominator there is dairy. So in the naturopathic profession, the first food we talk about is how much dairy do you consume? So a lot of patients benefit from removing the dairy. And then they say, well, how long do I need to do this? Well, I usually say 2 to 4 weeks because the skin turns over in about 30 days. So if
Mhm.
you have a whole bunch of acne and you go dairy free for 2 weeks and your skin is 50% better, we'll give it more time, right? So it can be related to food sensitivities in general. It can
Mhm.
be related to deficiencies of zinc or deficiencies of essential fatty acids, oils,
Mhm.
and it could be a clogged liver. It could be constipation. So I've seen acne respond to a variety of things. And almost always it's internal. And I don't know if I can say this on air, but I will. It's funny. I like to joke around with my patients and I tell them some, I warn them and I go, okay, I'm warning the listeners. I'm going to tell you something funny, maybe a tiny bit vulgar, but it is what it is. So if you put your finger in your mouth and your finger was long enough, it comes out the back side, right?
Yeah.
Kind of funny, right? I think it's funny.
Yeah.
Anyway, the
Yeah.
human body is like a big weird donut, and there's this tunnel that goes down the center of our body called the digestive system.
Okay. And
And
it would go,
lining,
so it would be like a clear path all the way.
well, you go in your mouth, you go
Yeah.
down your esophagus,
Yeah.
down your stomach, down your small intestine, down your large intestine. It's a big hollow tunnel with different structures and functions along the way. Sometimes I call it the assembly line, right?
Yeah. Okay. Yes, I've heard you say
But
that.
yeah, but think more about the donut. That if you had a circular donut with a hole in the middle, your typical little donut, that the inside of the donut is attached to the outside of the donut, inside the hole, right?
Okay.
And so same thing with our body. So the skin on your cheek, if you just touch your cheek and then you go towards your mouth and inside your cheek, it's all one big sheet of,
Yeah.
we call it skin and mucous membranes. It's one system in the body. So if
Okay.
there's something going on with your stomach, liver, pancreas, intestines, it's hugely related to what your skin looks like externally on your face, on your arms, on your legs.
That is so true. That,
Yeah.
that completely, like when you think about it, sure, your skin will mirror what's going on the inside. Correct. That makes,
Yeah.
yeah, of
It's
course.
all one big funny shaped piece of skin, inside,
Great.
internal or external. So that's how I kind of get people because patients come and they think, "Oh, what can I put on my skin that's natural?" Sure, there are things you can do. You can do chamomile products, you can do castor oil, you can like a tea tree oil is very popular topically or as a steam facial. Those are all work because they're antibacterial, or the chamomile is anti-inflammatory, calendula. So yes, topicals exist, especially in herbal medicine, but the real treatment plan from a naturopath is going to be talking about your insides, whether it's your gut health, your microbiome, how many bad bugs and how many good bugs are there overall, or a zinc deficiency or a liver dysfunction, and the rest of your body will give you the symptoms that will put you into one of those categories.
Okay.
Mhm.
So if someone comes into your office and that's what they're suffering from, take us through a typical a typical meeting with you, a typical appointment.
Mhm. Usually it starts with tell me the story. How did it start? When did it start? When is it better? When is it worse? And that tells you a lot. And then we usually thoroughly discuss the chief complaint, and then I ask you about the rest of your body. Do you get migraines? Do you have hemorrhoids? Do you have varicose veins? Do you have poor vision? And so those were a bunch of liver symptoms. So if the person said, I have acne and yes, 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 then it might be a liver cleanse that I give them. And
Okay.
then you reinforce that with the physical exam.
Okay.
Yeah. And then with minerals, I usually measure the hair. You've had a hair analysis.
I have a couple times.
Yeah. And then I also look at the fingernails. So the fingernails are part of the skin system as well. Are they ridged, peeling, splitting, cracking? Do they have white spots on them?
That's an
So that's
indication of
that's a
lack of zinc, correct? The white
exactly.
spots.
Someone's been listening. Yeah, exactly. So just things that you weren't noticing or didn't know and didn't think it was a big deal, and all of a sudden it connects all the dots, and yeah. So that's one of the ways that zinc shows, but in other age groups, teens are not the only people that can have acne.
Exactly.
So sometimes people have adult onset acne, but it's also usually hormonal.
Oh, really?
Yeah,
So what
so
would be
so
the
it
hormones then? Again, the DHT elevation
it
or
could
something?
still be DHT, but it could be estrogen dominance.
Oh,
So if you find that your skin breaks out before every period, that's
yes.
a time of the month that you're supposed to have more progesterone. And if it's not there, then your acne is tied more to your female hormones, not necessarily DHT.
Okay.
Or
And
if your skin breaks out at menopause. Again, so the story tells you a lot. And
okay.
sometimes people just don't connect the dots.
All right. I
And
know.
sometimes
Yeah.
the number of times patients come in and they say, "Oh, I've had this skin problem. It doesn't have to be acne. I've had this skin problem, this rash, this whatever, since, oh, for like a few years." Okay. Like a few years, 2 years, 3 years. Yeah, something like that. I go, what were you doing? Were you traveling? Did you get a pet? Oh yeah, I had food poisoning in Mexico. Yeah, maybe it started after that. So, and actually I've had irritable bowel syndrome since then too, right? And so
Mhm.
that might be more of a gut reaction person. And very often those people will say, yeah, I can't handle milk anymore. But you weren't born like that. So
Yeah.
it's not a lactose intolerance. It's an adult onset dairy sensitivity, which is actually a symptom of parasites to a naturopath.
Oh my
So
goodness.
avoiding the dairy can help you look better, but you might need to do a little more than that because you want to go back to your usual self that did not react to dairy.
Okay.
Mhm.
It's so connected and it's so deep.
And it's so personalized.
Yes.
So I'd say 80% of my patients, I will find they need zinc, but that's probably not the only thing I'm going to say.
And now on the other side of this, I don't know if we need to do a separate episode, but what about people who suffer from the scarring from acne?
Zinc works on that too,
Oh,
actually.
it does?
Zinc is for wound healing, and I do see a lot of healing of the light brown under the skin. So the skin surface might be smooth, but the discolorations can improve quite a bit from zinc, essential fatty acids, taking a big break from dairy. So there's a lot of hope there.
Okay, so how would one take zinc? Is it just little tablets? Like, how do you take zinc and how much should you take?
It comes in liquids and capsules and lozenges. The dose really varies on the age of the person,
I
how
see.
good they digest, and what their zinc status is. So that the answer to that is very individual.
Okay. All right. Is there anything else we could share? I mean, aside from the outside in, which is the cleansing and different products, is it better to try to use more natural things on the skin, on one's face?
Oh, absolutely. And that's a great thing that you've brought up because our skin absorbs everything.
Oh, yeah.
So in the naturopathic profession, we say don't put anything on your skin that would not be safe enough to consume. If you can't drink it, don't put it on your skin.
Oh my goodness.
Yeah, because it absorbs.
Of course.
Yeah.
I've, like, how old am I? And I'm just like realizing this now. And I've known you
Surprise.
my whole life, I feel. And I just,
Yeah.
oh my
Yeah.
God.
Yeah.
Oh my God. Like every product I should throw in the garbage then because I completely would not anyway, oh my goodness. That's really, really important. So
Yeah.
would you say then, before we say goodbye, that it's something we all maybe want to take stock of what we're using as cleansers and
Absolutely.
how to
Absolutely.
ah,
That's a whole different topic.
it is okay.
Yeah. Yeah,
Let's
and it
remember that. And let's,
definitely, definitely. We'll talk more about skin. We'll talk about topicals for
okay,
sure.
we'll do that then next time. Anyway, I think that's about it. Is there anything else we should add before we say goodbye?
No, I think that covers all the main answers as far as a naturopathic treatment plan.
Okay.
But there's also, I can definitely talk about clean living and clean skincare for sure.
Okay, well, that will be another, that'll be our part two, I guess. Um,
Definitely,
yeah,
definitely.
yeah, there's a lot of information there, I'm sure, that you could share with us all. So, thank you all once again for listening. Please follow us on social media. We do have a Facebook page and Instagram and Twitter and, or no, X, I guess. Um, and yeah, thank you.
Thanks for listening.
Yeah,
Bye.
bye. Bye.